Good day, I'm Vannilyn Vicente from BSNPA, and I will demo the nasogastric tube feeding. For the assessment, assess the doctor's order. Assess the client's level of consciousness and level of knowledge and understanding. Assess the availability and functionality of the needed materials. Assess for any clinical signs of malnutrition or dehydration. Assess for allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula. Notify the primary care provider if any incompatibilities exist. Planning. Before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings. Prepared equipment. Correct type and amount of feeding solution. 60 ml catheter tip syringe. Emesis basin. Clean gloves. pH test strip or meter. Large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or prefilled bottle with a drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding if using open system. Water 60 ml unless otherwise specified at room temperature. And feeding pump as required. Implementation. Procedure. Prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort but may cause a feeling of fullness. Perform hand hygiene and observe appropriate infection control procedures. Provide privacy for this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Assess the residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. Rationale: an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. Rationale: clamping prevents air from entering the tube. Ensure client comfort and safety. Secure the tubing to the client's gown. Rationale. This minimizes pulling of the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Rationale. These positions facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. For the evaluation, evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart.